And of course, Dr. Snyder, in your specialty as a reproductive and perinatal psychiatrist, you are also being faced with the reality that a lot of patients are facing, which is lots of women are pregnant across the United States and in New York City. Pregnancies are happening. We cannot delay births. We cannot delay prenatal care, yet all of the restrictions and recommendations apply to this patient population as well.
Yeah, it is an incredibly difficult time to be pregnant. As you said, from the beginning, from conception onwards, basically, we don't, obviously for everybody, this is an unknown illness, right? We don't know this is a novel virus. And in pregnancy, especially, we want to know everything we can. What we do know, obviously, is high fevers early in pregnancy can present risk. That's just a general thing. That's scary, right? And so as a pregnant woman right now, all a woman can do is really stay truly indoors. She can self-quarantine, but the level of unknown is so profound that by definition, it's going to cause anxiety. If it didn't cause anxiety, you would wonder why. Because it's a normal response to being kind of hanging out there. We just don't know. And there are small studies coming in and out, but we don't know what's going on. So basically, as a pregnant woman, it's incredibly scary. And, a vast majority of my patients are also, so there's the fear, understandable, which to some degree can be mitigated by virtue of just preventing exposure by not going out. I mean, really staying home. And if your partner is going out, having he or she be as careful and protected as possible. Social distancing, all of these things, hand washing, changing. I have a patient who was joking that her neighbors get a great show every single day. Because he literally strips down outside the door and then walks right to the shower, does not pass go, because they're just being very, very careful, which is what they should do. The other thing that is becoming an issue and people are getting very anxious about is the restrictions on partners being present in the delivery room. This is it was mandated in New York City. It was then taken away as a mandate. But frankly, the restriction was put there to protect women and their babies, most importantly, their babies. I think the mandate was for babies mostly, because if a partner happened to be COVID positive and we didn't know, that could be very dangerous. Also, I mean, there's a myriad of reasons why the restriction was put there. There's also obviously a limit, a shortage of PPEs in terms of gowns and masks and all of these things. But ultimately, this is all irrelevant to the woman who's sitting there going, oh my God, I'm going to have a baby, quote, by myself. And I think the most important thing to remember is you have to reframe it. This is unlike anything we've ever experienced, but you don't have to be by yourself. Meaning what? So I think I've been suggesting to my patients all on and on, that they meet every single OB in the practice so that whomever is going to be delivering them, they feel comfortable with. Is that going to take the place of their partner? Absolutely not. But I think also it's important that they not have a new person walking in to deliver them. Number two, and by the way, I think I'm getting a little message that Dr. Duke is coming back. Number two being that, they have a true plan in terms of having FaceTime and having, everyone set up to be there with her during delivery. So FaceTime right now or Zoom or whatever is a godsend. Is it the same thing? No, but you know what? Women are warriors and women can do this. And it's not what anyone anticipated. It's not what anyone wants. But, I think the important thing to remember is you can do it. and you can do it well, and you are a rock star for doing it. And at the end of the day, you are going to have your baby. And that is, you kind of have to have your eye on the prize, but it's very, very scary. Very scary. Ultimately, also, the other thing that women are getting worried about is what's called vertical transmission, being if I'm pregnant and I get COVID-19, can my baby get it while I'm pregnant? Ultimately, do we know, definitively know? There have been studies, small studies, but there are studies that so far are really reassuring that show there is no indication of vertical transmission. But we can't, can we say for sure? No, but the studies that have come out of Wuhan so far have not shown any no babies have been born positive to moms who were positive in pregnancy. So that's really great.